안녕하세요, 여러분. Hello, everyone. Can you see my slides?
Yes, we can see it pretty clearly.
Perfect. My name is Lindsay Deneault, and I'm the Assistant Vice President for Partnership Development at Atrium Health. Thank you so much for the opportunity to speak about experiences building innovation districts and bioclusters in Houston and in Charlotte. My background is in biomedical engineering and business, and I'm really passionate about helping entrepreneurs bring innovative solutions to patients and clinical teams who ultimately need them. After attending business school, I was hired as the first employee at the Texas Medical Center in Houston, Texas, to launch our Innovation Institute. And while my focus there was more on the programmatic side, I'm going to share a little bit more about the physical spaces that were part of that growing biocluster in Houston. And as Dr. Choi mentioned, I now lead partnership development at Atrium Health. And during this conference, you also heard from our Chief Strategy and Transformation Officer, Dr. Srestha. As part of our strategic combination with Wake Forest School of Medicine and the launch of a new medical school in Charlotte, I'm excited to share more about our journey to build an innovation district here in Charlotte, North Carolina as well. And then finally, having been through two very different experiences in Houston and Charlotte, I have a few lessons learned about both of these experiences. So the impetus behind the innovation focus within the Texas Medical Center dates back to 2012. The leadership saw a vast amount of research that was being conducted, hundreds of millions of dollars in federally funded research, significant IP in therapeutics, and really top researchers that were being recruited to Houston. But they also saw that there were a number of instances where investors came from California and came from Boston, took that intellectual property and moved it outside of Houston. There was one successful exit of Tanox to Genentech for over $900 million, and that was an example of the talent leaving Houston along with that exit, which made it a little bit challenging to build the momentum that we really needed in Houston to build up that biocluster. So there was a goal to make Houston what we were calling the third coast of medical innovation after the east and west coast of California and Boston, and really become the place where good things are and not just where they come from. So at the time, the Texas Medical Center leadership's vision was to bring together the 21 distinct hospital systems around shared goals and initiatives, innovation being the first. So feedback was sought from stakeholders across the city around what the ecosystem was missing. And things, I think, similarly to the previous talk, an accelerator, investment fund, lab space, these were all strategic areas of focus. So our strategy at the time was to create both the physical spaces to foster those collisions and then the programs to support all aspects of an entrepreneur's journey, and then leverage partners to bring in expertise and resources where we didn't have them. So I'm going to begin with some of the programs. The Texas Medical Center Accelerator has two programs, one focused on medical devices and the other on digital health. The key differentiator in that program was we would meet with the hospitals to identify their focuses and then source companies worldwide based on those needs. And then use the 6-month program to de-risk them, build relationships with the different health systems. And the ultimate goal was that those startups would get some sort of a commercial deal with the different health systems. The TMC Biodesign was a 1-year program where multidisciplinary teams spent several months shadowing in hospitals to identify totally unmet needs, and then they would prototype solutions and ultimately build a business. So this started from all the way from the idea and moving forward with the formation of a business at the end of it. And then one of the newer programs is an accelerator dedicated to cancer therapeutics. And this is a great example. You mentioned the question around state and private collaboration. This is an example of how federal and state funds can be used to support innovation. The state of Texas allocated $3 billion in grants to support translational research in oncology, and this is one program that's funded as a part of that. So CPRIT is a reason why so many oncology startups are launched in Houston, especially around the MD Anderson Cancer Center. And then the previous talk also talked about, venture funds and access to funds as a key gap in different clusters. So to bridge a gap between early grant funding and then later stage venture capital, the TMC formed a $25 million fund to invest directly into startups that participated in one of the programs, using the program to conduct diligence on the team and the company. And in the last couple of years, there's been a number of investments that have been made in both those digital health and medical device startups. Through these programs, we measure company formation, relocation, hiring activity, contracts with TMC Health Systems, and funding from the venture fund as metrics of success. But one of the things that we would always say is it takes a village to raise a startup, and no one single program can be responsible for taking a company all the way from idea to impact. It's important to develop programs that specialize along the entrepreneurial life cycle and connect the teams to those resources at the right time. So the example I'm sharing right now around Alleviant is it began as a need in biodesign, and then after becoming a company, participated in the accelerator program, utilized office space and wet lab space with Johnson & Johnson's J Labs, and then ultimately received investment from the venture fund. The company also leveraged business plan competitions at Rice University. So connectivity with the university ecosystem is also really critical. So when we think about bio clusters and innovation districts, we tend to look more at the space. And the TMC innovation space actually began as an old Nabisco cookie factory. And we used to say that instead of making cookies, we were making companies. And so this is what the space was reframed and built over the course of about 6 years. We built about 200,000 square feet as TMC Innovation, and a variety of programs there to support all of the entrepreneurs. So there are now 4 distinct spaces for companies of all stages and types, including co-working space and wet lab space, and then equipment for medical device development. And they say everything is bigger in Texas, or at least that's what you say here. And so this is a parking lot right now, but the vision for TMC3 is to turn that parking lot into the future TMC3 Innovation Campus that's currently under construction. So of the 21 hospitals in Houston, 2 committed as anchor tenants alongside the 2 universities. An assessment was done where we conducted an economic impact assessment to figure out the impact that this kind of a campus would bring to the city of Houston. There were near-term impacts around construction jobs, certainly, but then long-term impact around higher paying biotech careers that would come to the city as a result of this kind of an investment. And then with anything like this, there's certainly the focus on jobs, but also focusing on making this a place where people want to live, work, and play, and including retail and green space in the plan was important. So now on to Atrium Health. In 2020, we announced the strategic combination of Atrium Health and Wake Forest School of Medicine. And this is the impetus behind the innovation district that we're building in Charlotte, North Carolina. Rasu may have shared with you just our size. We operate 38 hospitals across 3 states. We have 71,000 employees, what we call teammates, including 4,500 employed physicians, and we serve a population of 7 million. As part of our 2025 strategy, we aim to bring together the academic powerhouse of the Wake Forest School of Medicine with the clinical scope and scale of Atrium Health. And to do that, we're building translational bridges between the academic research and the clinical enterprise. And as I mentioned earlier, my focus is on partnerships and new ventures. So over the last few years, we have aimed to demonstrate tangible examples of wins, both spinning technology out and also bringing technology in through partnerships. So we have successfully translated Atrium Health intellectual property to fast-growing startups like ML Bio. I think you'll hear from Dr. McClendon later in the conference. And we've also invested in companies through our own $50 million strategic investment fund, and then formed partnerships around new products and solutions. To enable that proactive approach, we leverage formal relationships with investment funds, technology accelerators, and consortium to source and vet new opportunities. In previous years, I know Dr. McClendon has shared some of our strategy around how we work with accelerators. One of the biggest initiatives that we're excited about coming out of the combination with Wake Forest is the launch of a 4-year medical school in Charlotte. So we are currently the only city of our size in the United States that does not have a 4-year medical school. And it has been identified as a gap for the city for over a decade, as well as a catalyst for growth if it's something that we can make happen. So we believe that the city is finally ready for that innovation district and the medical school, given that we do have a large talent cluster, a growing data science sector, and then a favorable business climate. But some of the more healthcare and research related metrics that we looked at when determining whether or not now was the right time is, what is the substrate that's around us that we're going to be able to pull from in building this? So looking at the number of people currently employed in life sciences, whether that's pharmaceutical and medical device companies across the state, the amount of translational research that's just within our own organization, and then the current economic activity that's happening. So there's a number of companies that are building their headquarters in North Carolina. A lot of the therapeutic manufacturing, whether that's in viral vectors or even things like vials for vaccines, are taking place in North Carolina currently. So this is the site. Before we announced publicly, we did assemble the land on which to build the innovation district, which is located between our largest hospital and some of the various tech hubs in Charlotte. This is some of the renderings that we use to share with the community what this could ultimately look like. And we brought on a developer that has a reputation for being able to build innovation hubs, innovation districts, and knowledge communities throughout the country as our key partner early on. So this is some of the news that's come out in the last year around this development. The medical school was the first thing that we wanted to convey to the community, given how much of a need it was. But using that support, we quickly announced the innovation district that it will be a part of. And then brought a number of political leaders to come and visit spaces both in North Carolina and in other states like Philadelphia, to see and touch and feel innovation districts so they could get a sense of what this could look like and if investments were made in North Carolina. And then the last point I'll make on this, since you asked the question earlier, is we have also made the request of both the city and county for tax incentives around certain infrastructure needs. So figuring out ways that we can collaborate with the local stakeholders around mutual investments in the space. And so the announcement that came out last week was that they have agreed to invest $35 million from local funds into the space. So a few of the learnings I just wanted to share, having gone through both of these experiences, is first figuring out what we want to ultimately build. And so in Houston, it was very different than in Charlotte around what makes our region strong and differentiated. In Houston, we had a ton of investment off of that $3 billion CPRIT funding going towards oncology startups and oncology research. In North Carolina, we actually have a different set of substrate, including a strong fintech environment, a number of headquarters moving in. And then we worked with different organizations to pull together those stats around what is the talent cluster that's located here. We involved stakeholders very early on, before we had ever announced anything publicly, to mine for the opportunities internally and then help shape what those differentiators are, including a number of the large banks that are in North Carolina. And then the third component, which is something that we're actively still working on, is that ecosystem strategy. So what are the key ingredients and how do you best foster interactions between ecosystem members and then the partners that are going to help execute? So we've been working closely with Wexford as our development partner, but also thinking about what are all of the partners that we aim to have in the space and focusing on what we're calling the super magnet anchor tenants. So what is the one or two partners that by bringing them into the space, they ultimately end up bringing 50 or 100 additional corporate partners into the biocluster. On generating support, I know this was a question that was asked earlier around how do you align hospitals or universities or governments, all these different stakeholders. And one way that we have identified in doing this is finding one thing that all of those folks care about, which sometimes takes a while to uncover. For Charlotte, it was the medical school. That was something that all of the different stakeholders could really latch onto and buy into. For Houston, it was large exits where the talent had left and the Texas Medical Center was willing to put the investment towards building the TMC Innovation Institute. And then one of the things that's sort of uniform about all of these is while the investments may come from a number of areas, that's corporate, philanthropy, federal and state resources, the most tangible impact is really around job creation and workforce development. And those are assessments that can be done fairly easily by third parties. And so being able to show we're going to create 11,000 jobs over the next 5 years as a result of this investment helps tell the story to the stakeholders who are ultimately on the hook for creating jobs in the region. And then, as I mentioned, the public and government support is critical, whether that's federal. There's certainly a number of initiatives around President Biden's Build Back Better that folks are looking at in the United States right now. And then within Texas, the CPRIT funding was something that was pivotal for the TMC work. And then in North Carolina, we're actively going after about 75 million in local tax grants. And then finally, more on the soft side and telling the story around these bioclusters, especially when they're coming in to a new environment. We created campaigns early on that included impactful community leaders that would show support for it when it was still early, it was still not fully baked, but the idea was something that we wanted to convey. And this didn't just include health system leaders. In Houston, it included different political leaders that wanted to be able to weigh in early. And then it's really hard for a lot of folks to really wrap their heads around what these innovation districts are going to create if they're not, living and breathing biotech every day. And so being able to take them to a simulation lab and see what we're doing on a dummy or be able to visit something that's analogous enough, even if it's in a different state, has been very helpful in getting our political leaders on board with support. And then something that was really important to us here is that unfortunately, Charlotte is not only were we the city that didn't have a medical school, we were also 50 out of 50 for upward mobility. So that's a stat that we're not super proud of, but it means that if you are born into poverty in the city, you are likely to stay in poverty. And so while we were building this innovation district, it was very important to articulate that not only are the 11,000 jobs that are going to be created important and impactful for the city, about 5,000 of those actually don't require a college degree. And so it was something that could really help lift people out of poverty. And there's going to be a number of workforce development initiatives to get folks into some of these into some of these jobs that don't require super specialized skills. And the last comment is, as we have all of these folks that we're going to be bringing in that come from a wide variety of backgrounds, being able to tell the story to that community audience is really important, because what we ultimately want them to say is, I can see myself there in that biocluster, even if I'm not a PhD scientist. So we really wanted to go for the feeling of inclusivity. So I have a few questions here, just more as takeaways as we start thinking about what is the right thing for Korea, and how do we start leveraging some of these lessons learned. But with that, I will say thank you. 감사합니다. Thank you very much.